Hi! Are you worried that your child has a high fever up to 40 degrees Celsius or 105 degrees Fahrenheit? But your child appears well and active. After a couple of days, the fever has subsided and then a rash has appeared. It might be Roseola. Keep watching to know more about this disease. Hi, I am Dr. Kristine Kiat. I'm a board-certified pediatrician. And in my channel, I give you weekly videos for any question that you might have in order to help you raise happy and healthy kids. Roseola. Roseola is also known as Roseola infantum or sixth disease. It is a viral infection that is commonly seen in children 6 months up to 24 months. Do not worry because it is a relatively benign disease and 2/3 of children who have it have no symptoms at all. So what are the symptoms of Roseola? Well, the symptoms begin 5 to 15 days after the infection, where the child begins to have a high fever as high as 103 to 105 degrees Fahrenheit or 39.5 to 40.5 degrees Celsius. The fever begins abruptly, and a small percentage of children have seizures with the fever. Usually, though, the child appears alert and active. Some children also have a mild runny nose, upset stomach, or sore throat. Then, on the 4th day, the fever begins to disappear. Then, a characteristic of Roseola is the rash, which appears in 30% of children. So, after the fever has subsided, a few hours to a day afterwards, the rash appears. It looks red and flat, and it is not itchy though. It is most commonly seen on the chest and abdomen and can also be found on the face, arms, and legs. So how do doctors diagnose this condition? Roseola is suspected based on the typical symptoms. Especially characteristic is the development of a rash after the fever has subsided. Tests are rarely done to confirm Roseola. Then how is the child treated? The child is given acetaminophen or paracetamol as well as ibuprofen for fever and comfort. There is no specific treatment for seizures or rashes. Now, what are the common questions that parents ask? First, is the child contagious? Yes, the child is contagious. It has an incubation period of 5 to 14 days from exposure up to the development of symptoms, and the child continues to be contagious 1 to 2 days after the fever has subsided. Another common question is, how is it transmitted? Well, Roseola is easily spread from person to person in daycare, preschool, among siblings, through contact with respiratory secretions and saliva. And another common question, when is my child cured? Well, usually after the fever has subsided about a day or two, the child is cured and no longer contagious. Alright, that's the end of our video. I hope you enjoyed watching and you have learned a lot. I'll see you on the next video, alright? Hi! I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?